G'day and welcome back to another health and wellbeing webinar with Kinaway. And today we have the topic of fatigue, as always, joined by Brendon, our wellbeing clinician here at Kinaway. Before we get too far into it, though, I would like to acknowledge the traditional owners on the land on which you may be viewing. I would also like to pay my respects to elders, past, present, and extend that respect to any Indigenous people who may be watching today. As I said right off the top, today's topic is fatigue, and I guess just as importantly, how do we manage fatigue? So without further ado, I'll throw over to my good mate, Brendon.
Thanks, Jason. Hi, everyone, and welcome aboard again today. I thought I'd do a little session on fatigue because, a lot of us could probably, get through the day with some yawning and feeling tired, but that could be because, we didn't sleep well or we had a big night or something. But that can pretty quickly turn into fatigue. So I thought we'd just go through what are some of the signs and what can you do, and just give you a little bit more information about fatigue. Look, the term fatigue is described is used to describe an overall feeling of tiredness or lack of energy. It isn't the same as simply feeling drowsy or sleepy. When you're fatigued, you have no motivation, no energy. Being sleepy may be a symptom of fatigue, but it's not the same thing. Fatigue is a common symptom of many medical conditions that range in severity from mild to serious. It's also a natural result of some lifestyle choices, such as a lack of exercise or a poor diet. And if your fatigue doesn't resolve with proper rest and nutrition, or you suspect it's caused by an underlying physical or mental health condition, see a doctor. They can help diagnose the cause of the fatigue and work with you to treat it.
Brilliant, mate. So I guess my first question is, what causes fatigue?
Yeah, look, there are many potential causes of fatigue, and they can be divided into three general categories. One is lifestyle factors, two is physical health conditions, and three is mental health issues.
Yeah, brilliant. So we'll start with the first one, lifestyle factors. Can you dive a little deeper into that for me?
Yeah. Look, if you're experiencing fatigue, your activities and other lifestyle choices maybe the root cause. For example, fatigue can result from physical exertion or a lack of physical activity, lack of sleep, being overweight, periods of emotional stress, boredom, grief, taking certain medications such as antidepressants or sedatives, using alcohol on a regular basis, using illicit drugs such as cocaine, consuming too much caffeine, and not eating a nutritious diet.
Fantastic. And I guess the next thing you spoke about was physical health. Can you explain a little about some physical health conditions and how they affect
fatigue? Many medical conditions can also cause fatigue. Examples include the anemia, arthritis, there's fibromyalgia, chronic fatigue syndrome, infections such as cold and flu. There's other diseases, Addison's disease, which is a disorder that can affect your hormone levels. There's the hyperthyroidism, hyperthyroidism, and a hyperthyroidism. There's sleep disorders, insomnia, eating disorders, anorexia. There's autoimmune disorders. There's some congestive heart failure. There's cancer, diabetes, kidney disease, liver disease, and emphysema if you're a smoker.
Yeah, wow, pretty in depth. What about mental health issues? How do they affect your fatigue?
Yeah, look, mental health conditions can also lead to fatigue. For example, fatigue is a common symptom of anxiety, depression, and a seasonal affective disorder.
Now, I guess you've mentioned some pretty heavy things there with diseases, disorders, mental health issues. When is it time to see your doctor, mate?
Look, you should see the GP if you're feeling fatigued, and you can't think of anything that might account for your fatigue. If there's no logical reason, you can't think of why. If you have a higher than normal blood temperature, or if you've experienced unexplained weight loss, if you feel very sensitive to colder temperatures, regularly having trouble falling or staying asleep, or if you believe that you might be depressed. If you've made efforts to address the most common lifestyle causes, such as lack of rest or poor eating habits and stress, without success, and your fatigue has continued for 2 weeks or more, make an appointment to see the GP. In some cases, your fatigue might be caused by a serious medical condition. Go to the GP if you've experienced fatigue along with any of the other following symptoms. So if there's any rectal bleeding or vomiting blood, severe headache, pain in the chest area or feelings of faintness, irregular heartbeat, shortness of breath, severe pain in your abdominal back or pelvic region, any thoughts of suicide or self-harm, or thoughts of harming another person, that's when you could probably go around the GP and head straight to hospital.
Brilliant, mate. Very practical. How will your doctor treat fatigue?
Yeah, so the GP's recommended treatment plan will depend on what's causing the fatigue. To make a diagnosis, they will ask you questions about the nature of your fatigue, including when it started and whether it gets better or worse at certain times. They'll ask if there's any other symptoms that you might be experiencing. They'll ask you other medical conditions that you might have. Ask about your lifestyle and sources of stress. And obviously any medications that you're taking. If your doctor suspects that you have an underlying medical condition that's causing the fatigue, they may order, some medical tests. For example, draw some blood or do some urine tests.
Brilliant, mate. So I guess when we talk about fatigue, I think about sleeping. So how much sleep do you think we should be getting?
The general rule of thumb with sleep is, well, I'm just about to bring it up. I think I've lost it there, Jason. But yeah, newborns, somewhere between 14 to 17 hours, as we all know. Infants between 12 and 15. Toddlers between 11 and 14. Preschool kids 10 to 13. School-age children between 9 and 11. And then for teens, 8 to 10, adults between 7 and 8, and seniors about the same, 7 or 8. There is a range in these numbers because sleep requirements are unique to each individual. The amount of sleep you need to function your best could be less or more than anyone else. Your sleep needs can also be affected by health and lifestyle factors such as pregnancy, illness, aging, sleep deprivation or sleep quality. Too much or too little sleep can lead to some different issues, including, having trouble with being alert, having problems with your memory, stress with relationships, lower quality of life, and increased chances of accidents like car accidents and that sort of thing. But there are some lifestyle changes that can help reduce fatigue. A number of measures can help lessen fatigue caused by daily activities. To help boost your energy levels and overall health, drink enough fluids to stay hydrated. We did a session on hydrated. We know when we're hydrated. So, drink enough to stay hydrated. Practice some healthy eating habits. We hear this all the time about, and we're going to do some eating webinars. I think one is due, at the end of this week, where we're going to talk about, healthy eating. Exercising on a regular basis. Yep, we hear that every time. But what can we do to kick it off? Is it about one short walk and build it from there? But exercising on a regular basis is good for us. Getting enough sleep is key. We've done a big seminar on sleep health. Have a look at that one as well. If you're not sleeping well, there's a lot of good strategies on how you can change some of your sleeping habits to really improve your sleeping. Avoid your known stresses. And this is all about making some lifestyle changes that can help reduce fatigue. Right? Is avoid a work or social schedule that's overly demanding. Take part in some relaxing activities. We've talked about mindfulness and breathing exercises, same as meditation, same as yoga, whatever is is easier for you. And the last one is obviously to abstain from alcohol, tobacco and other illicit drugs. These lifestyle changes may help ease your fatigue. It's also important to follow your GP's recommended treatment plan for any diagnosed health problems. If left untreated, fatigue can take a toll on your physical and emotional well-being. If you're interested in asking what's causing you to be so tired, there's some medical conditions that can lead to fatigue. If your exhaustion continues beyond just a few days or weeks, you should head to your GP for a checkup. One of the causes could be iron deficiency. It's also called anemia, which we mentioned earlier. It's a condition that can make you feel extremely run down and exhausted. That's because iron is what produces red blood cells. And without enough red blood cells, your blood can't supply your organs with the amount of oxygen they need to function properly. Other symptoms of this condition include shortness of breath, heart palpitations. So iron deficiency is common in women who still menstruate, and about 1 in 20 men and postmenopausal women. Another cause to be so tired is the sleep apnea. This is a common condition where your throat may narrow or even close for 10 seconds or more as you sleep. This can make it difficult for you to breathe, causing you to wake up at night as your body reacts to the stopped airflow. Waking often at night can make you feel tired throughout the day. Sleep apnea may also cause you to snore and have a drop in your own blood oxygen levels. So this condition is more common in overweight, middle-aged men. Another cause for being so tired is depression. Tiredness is a common symptom of depression. Depression can leave you feeling drained of all your energy, and it may even make it difficult for you to fall asleep or cause you to wake up early each day. Other symptoms of this mood disorder, which include feelings of hopelessness and anxiety, low sex drive, and aches and pains, can range from mild to severe. Another reason you might be feeling tired is pregnancy. Obviously, fatigue is one of the earliest symptoms you might experience during pregnancy. In the first trimester, your body produces a lot of progesterone. That's not progesterone, it's progesterone, a hormone that can make you feel tired. Other early symptoms of pregnancy, including missed period or sore breast, nausea, and increased urination. If you think you might be pregnant, you can visit the GP or take an over-the-counter pregnancy test. Diabetes is another cause of being tired. Being overly tired is one of the main symptoms of diabetes. You may also feel excessively thirsty, use the bathroom more frequently, or lose weight. Since diabetes is caused by too much sugar in your blood, a blood test may be able to help your GP with the diagnosis. The chronic fatigue syndrome is another cause for fatigue or being tired. Have you been extremely tired for more than 6 months? You might have CFS, chronic fatigue syndrome. Even if you're getting good rest, you will still feel tired if you have this condition. Sleep debt. Humans can't live without sleep, right? So for many people, sleep debt is to blame for feeling chronically tired throughout the day. Sleep debt happens when you don't get enough sleep for days, weeks, or months on end. It can have negative impacts on your health, like elevating cortisol levels or creating insulin resistance. You can't make up sleep, but making lifestyle changes can help tremendously with getting your body and mind back on track and feeling rested again. Think of it as, repaying your sleep debt. Try sleeping in a few extra hours on the weekend or going to bed a few hours early at night. So in a nutshell, when's a good time to see your doctor? Make an appointment with the GP if lifestyle changes and better sleep habits aren't helping you. So you should also see your doctor if sleepiness is accompanied by symptoms of the conditions that we've talked about, or if you have any other concerns about your health. The GP, your GP can perform tests depending on what they think might be causing your exhaustion. It might be helpful for you to keep a sleep diary to give your doctor a full picture of your nighttime habits, and be sure to include when you fall asleep and wake up, how often you wake at night, and any other symptoms that you might be going through. What I might do too is, if you are feeling tired, it's common for people to become tired or even fatigued in our fast-paced modern world, right? Many times, you may find yourself running from one activity to the next, not pausing or taking the time you might need to ground, balance, and soothe your soul. It's not always easy to pinpoint the exact reason you're feeling low in energy. If you're feeling tired persistently or for reasons that aren't apparent, make an appointment to see the GP. It could be the sign of an underlying condition, as we've said, especially if it's interfering with your daily life. Signs that tiredness could be something more serious include unexplained pain, fever, and headaches. The first thing you can do as far as your lifestyle choices are to eat a balanced diet. One reason to follow a healthy, balanced diet is that you'll boost your energy levels. Ensure you're getting plenty of nutrients by eating whole, fresh foods from a variety of food groups. Pair unrefined carbs with protein to sustain energy levels. Include plenty of fiber. Follow a balanced diet. Also promotes healthy digestion. You can also, as we said earlier, get regular exercise. The benefits of regular exercise are widely recognised. Exercise releases endorphins that naturally boosting your energy levels. So it can also lead to a more high quality sleep. There was a study that was done, found that regular exercise can reduce symptoms of fatigue. Do what you can. If you're not exercising at the moment, it starts with the first attempt. And I don't know what that looks like for you all, but it's the first attempt. And once you've done it, and we can all do it. We've all done exercise before. We all know what it looks like and feels like. So it's not like we can't do it. But if you're not exercising at the moment, start with something and then build from there. Go at your own pace. Don't feel like you have to do it every time or every day, because the minute you miss a day, we can beat ourselves up about that sort of stuff. But just start with one and then do the second one when you can, and away you go and start doing some exercise. We've got to drink more water. That does help with signs of fatigue. So stay properly hydrated. We did the hydrate session the other day, particularly the hydration at work, because dehydration can lead to low energy levels. It can also have a negative impact on our sleep by drying out our mouth and nasal passages, and can lead to snoring, leg cramps even. Plus, it can make you less alert and mentally clear the next day. Cut down on the coffee. Lowering your caffeine intake can give you more energy in the long run. Though caffeine may give you an initial boost of energy, after it wears off, it may leave you feeling depleted. So slowly reducing your caffeine intake will help you reduce feelings of withdrawal as you balance out your natural energy levels. I don't know what the average person has these days in regards to coffee. It would be interesting I might actually do some research on that and just see what the average person, how many cups of coffee they're having a day. It would be interesting because it's important that if you are having many cups of coffee a day, the advice is just to slowly wean yourself off. Don't just completely go off it, but you can slowly wean yourself off if you're having too many cups of coffee a day. Got to focus on your sleep. Proper rest is essential if you want to maintain energy levels throughout the day. Relax before going to bed, possibly doing some gentle stretches. Improve your sleep area by keeping it clean and maintaining an appropriate temperature. Some other tips for sleep, and we did the sleep webinar, but practice guided relaxation. Relax before you go to bed. If you've got a good mattress, if you've got a good pillow, and what are your sheets like, your doona and blankets, are they all comfortable? You wear loose natural fabrics when you go to sleep. If you're suffering from some tiredness, you could do a journal about your sleep. When you're going to bed and how many hours you're getting sleep, and just have a look at it yourself and study yourself, and you might actually find where you might be falling down a little bit when you're not getting enough sleep. Going to sleep and waking up at the same time each day is a good one. Almost impossible for shift workers and all that sort of thing. But if you are in a regular daytime job and you can go to sleep and wake up at the same time each day, that gives you a really good routine, and your body starts to recognize it and will start working with you. And you can use earplugs too if there's noise, eye masks if it's too bright. There's other little things you can do as well. Ditch the alcohol. So alcohol throws your body off balance and leads to poor sleep, especially if you're dehydrated. Even though alcohol may seem to help you fall asleep, you won't sleep as deeply. When you do have alcohol, drink in moderation and try to have as many alcohol-free days as possible. Address your allergies. So, the chemicals released in your body to combat allergic reactions can cause you to feel tired. So they can bring on inflammatory sinuses, airways, or digestive system. Accompany head and nose congestion can cause you to accompanying head and nose congestion can cause you to sleep poorly. So these factors can contribute to brain fog, making it difficult to concentrate or complete your daily activities. Try and reduce your stress. Stress can zap you of the mental and physical energy needed to carry out your day. So, stress stress has a negative effect on your sleep patterns as well, and your bodily systems and overall health. So reduce some stress in whatever way your heart so desires. Go and spoil yourself, have a spa, go and relax. Mindfulness, we've talked about that. Or even curl up on the couch and just watch your favorite movie. You can also do a mental health check. Check in with yourself to establish what mental patterns may be causing low energy levels. Anxiety symptoms include feeling worried, irritable, and nervous. Symptoms of depression include feeling sad, restless, and hopeless, but conditions can lead to unhealthy sleep patterns and cause tiredness, which can lead to fatigue. So consider seeing a therapist. Like you can always go and see your GP and get a referral to a therapist and talk about the cognitive behavioural therapy, the CBT. It's very common and it's got great success rates now in today's society. And this method helps you to get you to the root cause of emotional issues so that they can be addressed and overcome. You could sit less. I see a lot of people in our office have got those desks where the laptop raises so you can stand up and do your work, but get up and move and get your energy flowing. This is especially important if you spend a lot of time sitting. Include short bursts of activity throughout the day, especially when you're feeling pressed for time. Get into the habit of regularly exercising. They do say that you should have a break from the laptop or from the computer every half an hour or an hour. But if you set a little timer, do it and go around the block. Making simple changes such as parking your car a little further away, or taking the stairs, or walking to do some errands. They're easy ways to sneak in a bit of exercise. Sneak in some, or prioritize iron-rich foods. So we mentioned the anemia as an iron deficient that can lead to tiredness and fatigue. This is due to low hemoglobin levels, which make it more difficult for oxygen to be carried to your tissues and muscles. It also weakens your immune system, making you more likely to develop illness and infection. So anemia is more common in women than men. Sometimes it occurs during pregnancy or heavy menstruation, but it can be treated through diet and medication. Some iron-rich foods, leafy green vegetables, fortified cereals and bread, obviously meat, beans, peas, lentils, liver, nuts and whole grains. Some of the really good iron-rich foods. You could have smaller, more frequent meals in terms of energy levels. Eating smaller portions more frequently throughout the day may be more beneficial than eating a few large meals. That's because it keeps your blood sugar levels stable. So eating every 3 or 4 hours will make it less likely that your energy crashes, and in turn you'll be less likely to reach for unhealthy food. You can avoid overeating at meals as well, and stop eating before you are entirely full. Quit smoking. You smokers can smoking can deplete your energy by reducing your oxygen levels and making breathing difficult. Quitting smoking is an attainable goal, right? And there are resources to help. Over-the-counter prescriptions are available. They could help you. The medications are more effective when combined with counselling. A lot of people have success with the what's it called when they put you into a bit of a trance. I forgot the word. Which one?
Hypnotherapy.
Hypno. Yeah. Hypno can be, they have success with that as well. Smokers, you can do that. Another one is to learn to relax. So take the time to completely unwind, relax, let go. Deep breathing techniques, gentle stretching, and that meditation sort of mindfulness stuff are excellent ways to unwind. Find peace in nature is another way to nourish your soul. Okay, so or you can just simply enjoy the beauty of doing nothing. But more importantly, you really got to refer to your GP if you suspect anything's going on. If you feel that the tiredness is unusual and in some ways coupled with some other symptoms, it might be time to go and see the GP. Feeling low in energy could be a result of an underlying health condition as well, and it's best to check it out. And finally, the bottom line, make some lifestyle changes to your routine to increase your vitality. Start with what is most appealing to you and go from there. If you don't want to go for a walk, but there's some other little bit of exercise that you think you'd prefer to do it, then start with that. You'll likely start to improve your energy levels so you can feel your best on a daily basis. Above all, honor your body and how you're feeling. Take a break and allow yourself time to rest when you need it. Avoid pushing yourself beyond your limits and commit to a healthy plan of action.
Fantastic, mate. I guess to wrap things up, how can people get in contact with you if they need to discuss anything further?
Thanks, Jason. To all you members, and it's not just the members of Kinaway, you business owners, it's also your staff and your family. The phone number is 1-800-KINAWAY. It comes directly through to you, as to me, I should say. As you know, my name is Brendon. I'm the small business wellbeing clinician based here at Kinaway. The service that I provide is completely private and confidential, and it is free to you guys. So generally, if anyone's experiencing any stress, anxiety, or feel like they need to have a chat, get something off their chest, that's exactly what I'm here for, guys. Give me a call if you're suffering from any of these symptoms, or things are getting too much, or if you just want someone to talk to. And get an opinion or a second of a fresh pair of ears. That's what I'm here for. Please get in touch if you like on 1-800 Kinaway. What am I? Monday, Friday, 9 till 5.
Fantastic, mate. Thank you very much for your all the knowledge you've given us today. Again, if you think you're fatigued or feel have any health issues, please contact the GP. But also, you've got Brendon in your corner behind you. And I guess that's it from us today, and we'll see you again next week when we jump on again. Thank you very much.
Thanks, guys. See ya.